This is Colleen Fitzwater from the Lobular Breast Cancer Alliance. Today, I'm pleased to be speaking with Dr. Karen von Baelen. Dr. von Baelen was recently awarded the 2022 Conquer Cancer Lobular Breast Cancer Alliance Young Investigator Award for Invasive Lobular Carcinoma Research. Dr. von Baelen, congratulations on your award.
Many thanks for the congratulations and also for the reward itself.
Can you tell me about your background?
So in 2016, I graduated as a medical doctor, after which I started my residency in gynecology and obstetrics. I worked for 4 years in the clinic, so pure clinical work in 3 different Belgian hospitals. Before I started my PhD. So during the clinic, I developed a special interest in gynecological oncology, mainly in breast cancer. And so 2 years ago, I had the opportunity to start a PhD on lobular breast cancer in the laboratory of translational breast cancer research that's under the lead of Professor Christine de Smet at KU Leuven.
What made you interested in studying lobular breast cancer?
I was always a bit more drawn to the more special subtypes of cancer, and lobular breast cancer is a special subtype, although quite common type of breast cancer. And I find it striking that as many women are diagnosed with lobular breast cancer as with ovarian cancer, but ovarian cancer is far more studied than lobular breast cancer. So there's still a lot more to discover. And I just want to be a part of the society that's changing the perspectives that lobular breast cancer is not just a form of breast cancer, but it is a special entity and it deserves all the attention. It deserves focused research on lobular breast cancer. And I'm very glad to see that those perspectives are changing, that more research groups are getting more focused on ILC, that more international initiatives are being developed, and that more awareness in general society is being raised.
It's so important. So why did this specific Conquer Cancer Lobular Breast Cancer Alliance funding opportunity, why did it appeal to you? What made you want to apply?
Well, first of all, my topic is entirely focused on lobular breast cancer. So I was very glad to learn that this award existed. And it's not easy to get funding for ILC research because a lot of funding initiatives see it as just a small part of breast cancer. And I think that breast cancer is already funded quite a lot. So they don't want to invest extra money in only 15% of breast cancer. And so initiatives like this are very important. Secondly, what appealed to me also was that it is actually an initiative from patients and patient advocates. It's from the LBCA together with the Conquer Cancer Foundation. And it gives the award an extra dimension. There's a lot of focus on working together with patients and patient advocates. The patient advocates are also involved in reviewing the applications. So that's very important to me as well.
The title of your research is Unraveling Progression and Treatment Resistance Mechanisms of Invasive Lobular Carcinoma through a Unique Postmortem Tissue Donation Program. And I understand that your research has multiple aims. Can you explain what the aims of this research are?
So we are performing a research autopsy right after the patient has died. So we actually call it more a postmortem tissue donation program, but in general society, perhaps research autopsy is a bit better understood. And we want to take samples of the different locations of the breast cancer, so of the different metastases of the breast cancer of ILC within one patient. Therefore, we are overcoming the problems of sampling metastases that exist during life, because not all metastases can be safely reached. Taking biopsies is painful, so you can't sample a lot of metastases in one patient. And one piece of a biopsy, it doesn't represent the entire lesion and it doesn't represent the entire disease. And so we get a lot of samples with this procedure, and we have 5 different aims that we do with these samples. We want to see how the metastases differ from the primary tumor and from the metastases between each other, so that we can see if some mistakes in the DNA are common between those lesions or if they differ, if different lesions have different kinds of mistakes within their DNA. We also want to see the interaction with the microenvironment. So you have lesions that are in the peritoneum, you have lesions that are in the liver, you have lesions that are in the lung, and we want to see how they interact with the normal tissue of each specific organ. Secondly, we also want to reconstruct the evolution of disease progression. So we want to see, did the metastasis come from the primary tumor or did the metastasis come from another metastasis? It's very important to understand that, and it's especially important for ILC, since we know that ILC can take a long time between the primary tumor and the development of metastatic disease or the detection of metastatic disease.
Right.
Thirdly, we also want to see, we also want to get back to the treatment that the patient has gotten. So we want to see that that specific lesion responds to that type of treatment or not, and to compare between those different lesions to see which lesions responded, which lesions were resistant to treatment, then go back to those mistakes in the DNA to see if we can correlate those mistakes in the DNA with resistance to treatment to learn how to overcome those resistances for treatments as well. We are also sending out samples to other labs within our institution and also to international labs. We are very grateful to be working with specialized labs for that, to create tumor models like mouse models or cell cultures. And these models can then be used for testing new treatment strategies. And at this moment, there are not much ILC models that are available. And then lastly, we also try to perform an MRI right after that, that is to guide the autopsy, but we will also report back to the radiologist if we have any incidental findings, so that we can see if the image interpretation can be improved with the incidental findings to see, were there any abnormalities on MRI that can help detect ILC in the future.
You're working with donated postmortem tissues. What are the challenges of obtaining and working with this tissue?
Well, as a clinician, you always aim to help the patients as much as possible. In getting better, you always want to give them as much treatment as possible, taking into account the quality of life. And it's not always easy to then talk about a project where they have to donate their body after their death, because you have been following those patients for already quite a while, and it feels, if you bring that up, that you yourself are a bit giving up hope, while they still have some treatment opportunities that are available. And it's a very delicate subject to bring up to patients and to patients' families, because you know that not everyone is open for it. Not everyone is at that time ready to already think about it or to consider it or to talk about it even. Although we do see a great altruism within our patients, and we do see that a lot of patients are willing to participate, but it's taking that step of starting to talk to that patient about that subject. It's not always easy.
With this research, is this specific to Belgium for donations, or because it is collecting postmortem tissue? How close to Leuven do you need to be?
Well, actually, we started this project with patients that were only seen in UZ Leuven, but now we are expanding to other hospitals as well. So Flanders is normally no problem. Even entire Belgium is not that large. So and Leuven is quite in the center. So if the patient is living in Belgium, it's no problem. Even if we look to the southern parts of Netherlands, that will even be possible but then yeah, we need to make sure that logistically everything is in place. But we do expect more patients to come from the other parts of Belgium, and we ask them to come once to Leuven to have just a conversation to get every paperwork in order and to already take a few samples if they agree.
Thank you. So how might the findings from this research help people with lobular breast cancer and metastatic lobular breast cancer?
Well, we hope to improve the diagnosis with going back to the imaging part, also by learning more about the biology of the tumor, that we understand better how it works, how it spreads, that we learn more on how we can interact with it, what we need to look for in the clinic to know if there are metastases or not. We want to develop insights in treatment resistance, and we hope that the creation of the models that we get, that they can serve in the finding of new treatment possibilities.
We at the Lobular Breast Cancer Alliance and you know that lobular breast cancer is understudied. You talked about that already, and that more research is needed to advance the understanding of it. Why do you personally think that studying ILC is important?
ILC is a different disease than breast cancer of no special type and of other forms of breast cancer. It starts already under the microscope. It has a different growth pattern. It has a different biology, and this leads to a different clinical behavior and also differences in response to treatments. So I really believe that we need to see ILC as a separate entity. It has been understudied in clinical trials. It was either excluded or only a small subset was included, but then no separate analysis were done. So there's still a lot more work to do and a lot more research to be done. And we also need to consider the different subtypes of ILC. So you have the classical ILC, but you also have other histological subtypes of ILC. And there's also a lot more research that needs to be done.
You mentioned that you had patient advocate feedback and perspective in your grant application. How was this helpful to you when you putting together your grant application?
Well, it all started already with the patients that were coming to us with really a demand to do more research on metastatic ILC, because there's a lack of research in metastatic ILC. And so there was really a need for research autopsies. And that's why we developed the study, and that's why we developed also this application. And so they were really helping us with giving more insights. The patient groups within UZ Leuven were helping us to set up the program. They gave us insights on how to best approach patients. They also are helping us to raise awareness about research programs in the global society. They're doing interviews with local newspapers. And so it's really important for us. I also have the opportunity to work together with the patient advocates of ELBCC, the European Lobular Breast Cancer Consortium. And they have written a most beautiful letter of support. So I'm very, very grateful towards the patient advocates of ELBCC for doing that. It's been a pleasure to work with them. It's also helped a lot for this project. For example, they have given me a platform on an IRIS webinar to already talk about this project. So it's great to work together with them.
You mentioned the ELBCC, and you will be attending the ILC Symposium in the Netherlands that is being hosted by ELBCC. This includes presenting to both fellow ILC researchers and to ILC patient advocates as well. Why do you feel an event like this is so important?
It's a great opportunity for networking between researchers, between patients, but also between researchers and patients. So patients can easily approach a researcher and ask them questions about the research, so that the researchers can explain everything in lay language, because that's not always easy to implement that in the presentations. And it's also great for researchers so that they know where the goals of the patients lie, what do they want to learn with the research, what do they want to achieve. So it helps us guide our research as well. So I think it's a great opportunity for both researchers and for patients to interact with each other and to learn from each other.
Wonderful. Well, thank you so much for taking time today with us again, and we wish you the best and look forward to your research findings.
Thank you very much. I'm very interested in working with you as well, and thanks again for the grant and for this interview as well.